the most common investigations that the doctors usually request, which is for those outside Nigeria, is called the CBC. That's complete blood counts. But if you are located in Nigeria, it's actually called FBC. That is full blood count. What does this full blood count or CBC mean? When the doctor requests for a full blood count or a CBC test, there are various parameters the doctor will be checking out for. In that one particular test, your doctor can be able to know your blood level, that's your hemoglobin level. And what does hemoglobin mean? Hemoglobin is more like the oxygen carrying part of your blood. So it's part of your blood that gives you energy that makes you active. If your HB, your hemoglobin level, is low, the person can be weak. The second thing the doctor is checking for when they ask for your full blood count, CBC, that's complete blood count, is your WBC, which is white blood count, to be able to tell us if you have an infection. You could have an infection, but the infection is bacterial, or it could be a viral infection. Please, those that want to just take antibiotics like that, you having an infection, that infection will respond to an antibiotics, because it's only bacterial infections that respond to antibiotics. Viral infections, they don't want to respond to antibiotics. Most times when you take it, you are just abusing it, because at the end of the day, the viral infection will run its course and you get better, especially if your immunity is strong. Then the next thing that your doctor is checking out for your CBC is your platelets. Your platelet, that is the part of your blood that clots. When you have an injury and you start bleeding, you find out that as the blood from coming out, that your platelets. The doctor is also checking for that. And from your full blood count, your doctor could be able to find out if you have cancer. So you can see that test that just says CBC or FBC, there are so many things that your doctor will be able to with you. Yes, it's one of the most common tests that is being requested for, but you can see that a lot of things from just that one specimen that is collected. So thank you very much for listening. As usual, I remain Dr. Amy Thompson, a medical laboratory scientist, a health advocate, an infection control specialist, a quality assurance consultant. I think that's just it for now. So thank you very much for listening. Bye.